Assalamu alaikum. Today I am going to discuss Norma Basalis. So, here this is the Norma Basalis. You can see this is the inferior view of the skull. Norma is Norma Basalis. For the sake of convenience, this Norma Basalis is divided into three parts. For the sake of convenience, is divided into three parts: the anterior part, the middle part, and the posterior part. The anterior, how it is divided? An imaginary line is drawn through the posterior free border of the hard palate, and an imaginary line is drawn through the anterior margin of the foramen magnum. So these two lines divides the Norma Basalis into three parts: the anterior part, middle part, and the posterior part. The part which is lying anterior to this anterior imaginary line is the anterior part, and the part between the two imaginary line is the middle part, and the part behind this imaginary line, which is passing through the anterior margin of the foramen magnum, is the posterior part. Okay, now let's start with the anterior part. In the anterior part, what all you can see? This is the alveolar socket. You can see the alveolar sockets. In these alveolar sockets, you can see there are some teeth you can see here. Okay, so these alveolar sockets lodges the upper teeth, and then you can see the hard palate. This hard palate is formed by two bones. Anterior 2/3 is formed by the palatine process of maxillary bone. Posterior 1/3 is formed by the horizontal plate of palatine bone. Okay, so this is how the hard palate is formed. It is formed by two bones. Anterior 2/3 by the the palatine process of the maxillary bone, and posterior 1/3 by the horizontal plate of the palatine bone. Here you can see certain sutures are visible. This suture anteriorly between the maxillary bone is known as intermaxillary suture. Then posteriorly between the palatine bones, this is the interpalatine suture. Then we have between the maxillary and palatine is the palatinomaxillary suture. So these are the sutures which is present in this hard palate. This forms the cruciform suture. Now there are certain foramens which we can see here. Just posterolateral to the palatinomaxillary suture, you can see the greater palatine foramen. Okay, and just behind to that greater palatine foramen, you can see certain small foramens. There are 2 to 3 in numbers here. This is the lesser palatine foramens, which pierces the pyramidal process of the palatine bone. Now let's discuss, and one more thing is there. There is a groove present here in front of the greater palatine foramen, which passes from the greater palatine foramen towards the incisive foramen. Okay, and incisive foramen, here you can see this is the incisive foramen. Incisive foramen is present in the anterior midline. It is a deep fossa which is present in the anterior midline of the hard palate. There, and on the lateral walls of this incisive fossa or foramen, there is presence of canal on each side, which is known as incisive canal. Okay, now let's discuss about the structures which are passing through this canals or foramens. Incisive foramen. Through the incisive foramen, the structure which is passing is the terminal part of greater palatine vessels and nasopalatine nerve. The greater palatine vessels runs from the palate to nose, and the nasopalatine nerve runs from nose to palate. Okay, now the structure which passes through the greater palatine foramen is the greater palatine vessels and anterior palatine nerve. Structures which pass through the lesser palatine foramen are the middle and posterior palatine nerves. So these are the structures which are passing through the foramen, which is present in the hard palate. Okay, now posteriorly, here you can see this is the posterior free border of the hard palate. Posterior free border of the hard palate, and in the midline you can see projected area. This is known as the posterior nasal spine. This is the posterior nasal spine. Okay, it's a pointed part of the bone, posterior border of the bone. In the midline, you can see a pointed part. This is the posterior nasal spine. And there is one more structure. When we trace from the greater palatine foramen, we trace it medially. There is presence of a crest which is known as palatine crest. This is known as palatine crest, which is present on both the sides. Okay. Now let's discuss the attachments on the posterior border of the hard palate. On the posterior border of the hard palate, there is aponeurosis. There is attachment of an aponeurosis which is known as palatine aponeurosis. On the posterior nasal spine, a muscle is attached which is known as musculus uvuli. It is a muscle of soft palate. Now, on the palatine crest, there is another muscle which is known as tensor villi palatini. Tensor villi palatini is also a muscle of soft palate. So, this is about the anterior part. Okay. So, in the anterior part, we can see the alveolar sockets, we can see the hard palate. So, the hard palate is formed by the fusion of two bones. Anterior two-third is formed by the palatine process of the maxillary bone. Posterior one-third is formed by the horizontal plate of the palatine bone. We can see the sutures intermaxillary, interpalatine, palatinomaxillary. These sutures form the cruciform sutures. Now, in the anterior midline, we have incisive foramen. It is a deep fossa present in the anterior midline, and on the lateral walls on each side there is presence of canal which is known as incisive canal. Posterolaterally, we can see just behind the posterolateral part of the palatinomaxillary suture, we have foramen which is known as greater palatine foramen. And behind this greater palatine foramen, we have lesser palatine foramen which perforates the pyramidal process of the palatine bone. Okay, so this is about the anterior part. Now I am going to discuss about the middle part. To study the middle part, we will discuss it in two parts: the median area and the lateral area. Okay. In the median area, you can see this is the posterior free border of vomer. This is the posterior border of the vomer bone. Okay, this posterior vomer bone articulates inferiorly with the palatine bone, the horizontal plate of the palatine bone, and when traced superiorly, this posterior border of vomer bone splits to form ala of vomer. This is the ala of vomer. You can see here, this is the ala of vomer. Okay. This vomer bone separates the two posterior nasal aperture. This is the posterior nasal aperture. It is also known as choanae. Okay. And in the median area, what all you can see? We can see the posterior border of the vomer bone, and a broad bar of bone is present posteriorly. Okay. So now, in relation to this vomer bone and the palatine bone and the medial pterygoid plate, we have certain canals present over here. So, first of all, let's take a look on the orientation of the bones. Here you can see this is the horizontal plate of palatine bone. Okay, this is the vertical plate of palatine bone. This vertical plate of palatine bone gives a process towards the sphenoid bone, which is known as sphenoidal process of palatine bone. And here this medial pterygoid plate gives a process medially towards the vomer bone, which is known as vaginal process of pterygoid plate. Okay, so in between the vaginal process of pterygoid plate and the sphenoidal process of the palatine bone, there is presence of a canal which is known as palatino-vaginal canal. Palatino-vaginal canal. And there is one more canal here. You can see this is the ala of vomer, and this vomer bone joins with the vaginal process of the medial pterygoid plate, and it forms the vomerovaginal canal. Here you can see a